See. Well, good morning, everyone. Thank you all for joining us on this Friday morning, Friday before a holiday at that, to learn about our expansion plans for AIM CCI. We are going to go ahead and get started in the interest of time because it is a Friday morning before a holiday. We may have a couple other people joining the call, and we will just let them in as they come. But our team is all here, and we're going to go ahead and get started. Feel free to drop your name in the chat, or you don't have to. We are going to go through this presentation this morning, pretty straightforward, but please put any questions that might come up as we are discussing this information in the chat, and we'll make sure that we have time for Q&A, or some members of the team may jump into the chat and answer questions as we go. So we are getting started. My name is Karen Schutz, and I am the Senior Program Manager for AIM CCI. Again, welcome. This is the National Expansion webinar for our second expansion cohort, and this is really just an overview to explore the options for bringing AIM CCI to your community. Okay. So our objectives today really are just to give you an understanding, to provide background and context of this project, and to explore options for becoming a partner with us in our national expansion. We now have a second option that we're excited to share with everybody today. So in addition to being considered a partner with a collaborative model, we are also now considering individual partners as individual organizations. We will go over our AIM CCI maternal safety bundles that were created for non-hospital settings, and then we'll talk about the expansion application. So forewarning now, you're going to hear my voice a lot on this presentation this morning. My apologies for that, but I'm really just here to set the stage and go through the backdrop of this project. All of our team members are not on the call today, but joining me is Dr. Ashley Calderon, who is our Clinical Implementation Manager, and Dr. Sani Sully, who is our Data Manager and Analyst. The other members of our esteemed team are here on the screen. Deborah Frazier, who is our CEO, Dr. Haywood Brown, who is our co-CEO and our medical advisor, Lydia Sawyer is our equity implementation strategist, Valerie Newsom Garcia, community transformation strategist. Alicia Roche, who is our communications director, is on the call today, as is Amber Wilson, who is our program coordinator. In addition to our staff here at National Healthy Start Association, we work with an esteemed group of consultants, including Sue Kindig, Deidre McDaniel, Dr. Fleeta Jackson, and Dr. Derek Griffith, who all advise us throughout the course of the project, from bundle development and implementation to other strategies. Okay, so first things first. I think some of you may have joined us for the initial expansion webinar, which was back in November, mid-November, when we kicked off our plan to bring on new partners nationwide. So this may be a little bit repetitive for some of you, but just to level set, the purpose of this initiative is to support the development and implementation of non-hospital maternal safety bundles. So if you're familiar with AIM, which is funded by HRSA, the original AIM project focused on QI for hospitals and developed maternal safety bundles for inpatient settings. This initiative is geared at really bringing in the community and addressing issues of safety during pregnancy and postpartum in non-hospital settings. So we are building upon the framework of AIM that was established by those initial inpatient bundles, and really starting to bridge the gap between inpatient and outpatient and how we bring in community into this work. So there was one award made, one cooperative endeavor agreement with HRSA was granted to National Healthy Start Association in 2019. And so now in 2023, we're actually entering into the last year of the pilot phase. So why non-hospital safety bundles? And I think likely for everybody on this call, you're here and joining us today because you know the issues and the challenges that exist, that what we're seeing in maternal mortality is actually occurring more outside of the hospital setting than within the hospital at time of delivery. So we had 31% of deaths during pregnancy, 36% at delivery or 1 week thereafter, and then 33% of deaths during postpartum. So definitely a need, and HRSA recognized this, that there has to be a complementary effort to really help undergird and support efforts in the community and not just inpatient and at the time of delivery. So the AIM CCI process really can be wrapped up in that we want to standardize care and services across the continuum for pregnant women and birthing persons in the US. So we begin with an equity framework. We like to say that all of our work is actually inculcated in equity. It's our North Star, and that we include the community voice as we endeavor in this work from the time of conception, creation, and how it's evolved now that we are working in different communities across the US. We bring those community providers and community voices together. A big part of our approach to this work is really to integrate social determinants of health as we look at these issues and really factor that in so that we're not just looking at health and safety from a clinical perspective, but really from all of those other factors that we know can impact a person's outcome, which are greatly influenced by those social determinants. We have identified benchmarks for assessing this work for the metrics, and Dr. Sully leads that work. We're really driven by the data. Before we begin bundle development, we look at what the data is telling us about these issues and can it be measured, how can it be measured in community settings. So beginning with equity, NASA has developed an AIM CCI health equity framework that has essentially 5 pillars: diversity, inclusivity and belonging, racial equity, respectful and equitable care, and community integration. And this can be found on our website. We will also be sharing this recording with anybody interested after today. Sorry, my computer got stuck there a little bit. So why is maternal health equity important? I think that the numbers really speak for themselves. It's the disparities that we continue to see and that have unfortunately continued to increase when we stratify our maternal outcomes by the demographic factors and race and ethnicity. And we're seeing that non-Hispanic Black women are disproportionately affected with poor maternal health outcomes compared to their white non-Hispanic counterparts. So some time ago, about 1.5 years ago, we embarked upon the work to really create tools to help organizations and to help communities start to identify their own level of capacity, to identify how they can bring racial equity to the work that they're doing. So with that, we developed the Racial Equity Learning Series, and it's a 7-module learning series that's online. It is self-directed, and the objective is really to understand the role of racism and how it is prevalent in how the system works, why we're seeing the disparities that we're seeing, and how providers, and when we use the word providers, we use it very broadly. We're not just talking about physicians, nurses, and clinical providers, but we're talking about anyone along the spectrum of care that intersects or works with a woman or birthing person along that pregnancy journey, how they work with the persons that they're seeing and how racism may be playing a part in that and what they can do to address that and to really work with equity at the focus. So RELS is available online, and it is also a foundational element in all of our AIM CCI community care bundles, and we'll talk about those a little bit later. When we talked about bringing in community voices, we've worked very closely with National Birth Equity Collaborative and also with Dr. Derek Griffith at Georgetown to really bring in that perspective of persons with lived experience and how their experiences are reflected in, the data that we're seeing in these communities that we were working. So these focus groups were conducted in each of our pilot sites, both with fathers. And so those would have been fathers that had experienced a birth within the past 2 years, and mothers and birthing persons also within that spectrum. So it was to give us insight to factor in, how behaviors of those providers might influence these outcomes, what the perception of those encounters with providers are, both for birthing persons and their partners, and then to really center knowledge to improve our work and how we develop these maternal safety bundles for community settings. This is just briefly, some quotes that we got from those focus groups. These specifically are from the INBEC group with mothers and birthing persons. And just as an example of what we were hearing across all of the sites, and some of the themes that arose were disrespect, disregard, mistreatment, and just a lack of connectedness from the time that person was in the hospital to what was expected or what the resources were, when they were discharged. So a lot of what we heard was just a feeling of not being listened to, not being heard, being disregarded in their own care, and then being left to kind of connect the dots of what's next, what happens after I leave the hospital on their own. From the fathers, similarly, these were the themes that Dr. Griffith's team came up with. Priorities and challenges, the responsibilities and expectations around fatherhood, resources that are needed for new dad, and then how to navigate and help their partners to navigate the system. So it was really very insightful to have these perspectives help guide our work as we were actually developing bundles, which we did throughout the last couple years. So who's testing AIM CCI? So again, this is a pilot initiative that was funded in fall of 2019. In early 2020, we kicked off our first National Maternal Safety Committee, which is a national committee that helps to guide and support the work for us at the national level. And then we started reaching out to communities to pilot this initiative. So we have a diverse group of community providers. They're clinical, they're non-clinical. They came together to develop a collaborative to really look across the system at what they could do collectively to improve their maternal health outcomes in their communities. And so these are our initial pilot site partners. We are in Fresno, California, Tulsa, Oklahoma, Grand Rapids, Michigan, New Orleans, Louisiana, Atlanta, Georgia, and Newark, New Jersey. I will say, and I'll just include this little caveat here, there may be some of you on the call today that I connected with earlier. If you are joining from any of these states, we have another phase of our expansion plan that is in state. So this particular webinar is really to address starting to partner and connect with new states where we are not currently working. So if you are in one of the states featured here as part of our pilot initiative, we are going to be doing in-state expansion in partnership with those pilot sites, and they will become mentors to new sites within their state. If you are, and I don't think anybody is joining from a state where we have our first cohort, but this particular expansion effort is really for us to look at partnering with communities in states where AIM CCI is not already happening. So just wanted to put that out there. You're welcome to stay on and join, and please feel free to connect with me, offline via email if you have any questions about the in-state expansion and what that means in these states. So, as I mentioned earlier, we kicked off our first round of national expansion back in November, and we selected the 5 organizations and states and communities listed here. We're working with the Dartmouth Hitchcock Clinic in Lebanon, New Hampshire. We are working with the Eli Collins Foundation and Williamsburg County Community Coalition in Williamsburg, South Carolina. We're working with Hello Neighbor in Pittsburgh, Pennsylvania. And then we're working with Martin County Healthy Start in Stuart, Florida, and Urban Baby Beginnings in Norfolk, Virginia. So considering what we know, the point of this webinar is really to help you all understand AIM CCI, what we're doing for expansion, and now that we have a second option, what course might be best for your community. And really, we want you to think about this based on your community needs, your community partners, and what you would be able to do to implement these non-hospital bundles in pretty short order. As I mentioned, we're going into our final year of the pilot. And so we really want to see how the community care AIM CCI bundles land in communities, and we need data to do that and to be able to show that. So which AIM CCI option is right for your community? And this is just a very simple flow chart that I put together to try to help articulate this. The first question to start with is, do you have an established and active collaborative working in your community around health-related issues? It can already be working in the MCH space or willing to prioritize and start to focus on maternal health outcomes in your community with a focus on implementing AIM CCI bundles. So if the answer is yes to that, you have a collaborative, then the next question is your collaborative willing to focus on MCH and implement the AIM CCI bundles? Then you keep going down that path. If you don't have a collaborative, then we're gonna suggest that you consider the new option, which is the option to come in as a single entity organization. If you do have a collaborative, they're willing to focus on AIM CCI bundles, they can share data, then we want you to consider exploring the original AIM CCI option, which is a local maternal safety work group collective impact model. And we'll talk more about this in just a minute. If you don't think that you're collaborative, maybe it's not as cohesive to really focus just on AIM CCI, or there's some issues, not everybody may be able to share back their data to your collaborative. If that's going to be a challenge or a burden, and you say, no, we can't go that route, then again, you still have an option to consider joining as a single entity option. If you are considering the single entity model, this new option that we have, then the question is, are you serving pregnant and postpartum women? Yes, then that's great. Let's keep going. If that's not the population that you serve, then that's pretty much a hard stop, because everything here is really geared to that, that group. So does your organization have a QI plan, some framework, an internal system to capture data? Yes, excellent, great option. If that's a no, then we think it's a hard stop, because that would be a lot to try to put in place, again, in a short time for this model. So I'm going to stop there. I'm going to check the chat just to see if anybody has questions, or if anybody wants to drop in a question now, or just raise your hand if you do have a question and want to come off mute. Okay, seeing or hearing none, we can keep rolling. So I know that's a lot to take in. I'm running through it pretty quickly. Okay, Katie, yes.
Hi, I see that my colleague Julie put something in the chat too. We were just wondering about the definition of the health collaborative, what that means, the established and active health collaborative.
Okay, that's a great question, and I think that's our next slide. So we're going to walk you through what we consider a collaborative. It's really based on a collective impact framework. And we'll talk about that in just a minute. Julie, was that also your question? I didn't see the chat.
Yeah, that's correct. Awesome.
Okay. All right. All right. So moving along. Hold on. I don't know why it keeps freezing. Okay. So when we put forth our plan to implement into pilot AIM CCI with HRSA, we did so using a collective impact approach in bringing community together so that we could really look at these issues from a systems level across multiple organizations. So for those of you who may not be familiar with the formal collective impact model, it's really, there are really 5 tenets to that you have a common agenda. In this case for AIM CCI, that common agenda would be to focus on improving maternal health outcomes, reducing severe maternal morbidity, and preventing maternal mortality in your community. So you want your collective to be able to focus solely on that agenda item. And collective impact is used and recommended when you are dealing with very complex problems that you're trying to solve. And certainly the issue of maternal morbidity and mortality is a very complex issue. So it fits well for this model. You have shared measurement. Those shared measurement will be the data, the metrics that we've put together, you know, to measure the bundle elements in community. So your collective would agree to have those shared measurement, right? And to share that data. The mutually reinforcing activities as it relates to AIM CCI would be the implementation of the non-hospital maternal safety bundles. So those actions, those elements that form the recommendations within the bundles are the activities that your collective then agrees to implement. Continuous communication, and I can't stress this one enough, and I think that this is one that really can become one of those pieces if you're going to go the collective approach, that you really focus on and identify early how you have that bi-directional continuous communication with the partners that you bring to the table, that you're able to articulate the processes that go along with AIM CCI in a way that they can understand how it fits for them. What we want to do in this collective impact approach in a collaborative is to bring this information to the table, but to have your partners identify where they see themselves fitting. And so as a lead organization, you know, it's really imperative that you're able to have that communication, have that understanding, and really keep the communication flowing. And then the 5th piece is that there's a backbone support organization. So for us, we call that backbone organization our lead organization. That would be the entity that actually contracts with National Healthy Start Association to implement AIM CCI in the community, with an agreement that they are going to convene a local maternal safety work group, which is what we call the AIM CCI collaboratives, and that they are going to then, you know, bring that group together, understand how they share information. They are going to be responsible for collecting and reporting out the data from all of their partners back to us. So that is our backbone organization. So the next slide is really just an infographic that further articulates our model for collective impact. And this is how our initial pilot sites in those 6 states and our first cohort partners for expansion have come in as collaboratives. So they have all brought their partners together around the table to implement AIM CCI. So, oh, and I'm just realizing I'm using our old infographic. We actually have a new fancier one. It has the lead organization out here as a gear kind of driving all of this work. So if you are representing an organization that would be the applicant for this, that would step up as the lead organization to say that you have the capacity to really drive this work in your community, then this would be you. You would be that lead organization over here. And we have, further defined the members of your local collaborative in, kind of grouped in these partners. So when you look at this tannish color, the inner circle that's surrounded by data, we consider this the implementation group. These are going to be your partners at the table that are providing direct services to women and birthing people in your community. They're seeing them during pregnancy, they're seeing them during postpartum. So that could be outpatient providers, an FQHC, an outpatient arm of a hospital system, early Head Start, who will see, new young postpartum moms, WIC, who are seeing pregnant and postpartum persons, Healthy Start, and your local health department, depending on whether or not they have those provision of services. All of these partners will come together around the table to implement what's at the hub is our maternal safety bundle. As implementation partners, they are going to agree to share data relative to their work and what they're doing in the space back with you. This orange circle, we consider them part of the local maternal safety work group, but they're in a different capacity because they may not be providing, they're not going to provide direct services. They're not going to be seeing clients, patients, participants in a program. But these may be folks from your Title V project at the state health department, local hospitals that have delivery services, other maternal child health membership organizations and groups, and then community residents, persons with lived experience that you can bring to the table to have visibility, awareness, and help inform and drive how this project works in your community. The most outer circle in this purple, we call just the awareness group. So these may be higher level policy people, faith-based organizations, payers, policymakers, health journalists, if you have them in your local community, that you might want to give visibility and awareness to say, this is the situation happening in our community. This is how we're trying to work on it together collectively, and really get them, to buy into supporting your efforts in whatever capacity they may be able to do that. For your payers, they may look at the work that you're doing and say, you know what, this really then informs how we need to consider, payment for maybe community health workers in our community or doulas. So it's really important that they might have visibility on the work, but they're not doing the work of this implementation group. So the implementation group would meet monthly. Your larger group could meet quarterly, or bring them together on an as-needed basis, or keep them informed in other ways without necessarily quote unquote meeting with them, but have an opportunity or a mechanism where you can keep them informed of the work that you're doing in community. So that is the AIM CCI Collective Impact Approach. That's the model that our original, our application and our partnership with HRSA, this is how we put forth doing this work in community, and this is how we've brought on all of our partners up until this point. This is really an example from one of our teams in New Orleans, and this is how they articulated how they bring their community together to work in their collaborative with community leaders, residents, local and state health department, researchers, consultants. They have a very robust, a very dynamic collaborative, and some members of the collaborative can kind of ebb in and out based on what bundle work you're doing. When we transitioned from postpartum bundle to the maternal mental health, they recruited new members to come in that were working in that space. As we look at the intimate partner violence bundle, again, they bring in new members based on the work that those bundles call for. So for the persons who had the question on collaborative, do you have any other questions on that, or did that kind of help clarify? And I see Ashley's been answering some questions in the chat. Thank you.
Yeah, I think it clarified
some.
the question.
Okay. All right. So we're going to keep rolling. Let me just check my time so that we do have more time for questions later. So this is what we're very excited about today, is to offer everybody an opportunity to think about a new option. So we met with our partners at HRSA. And again, going into our 5th year of this work and our final year of piloting, and recognizing that forming a collaborative, keeping a collaborative moving and engaged takes a lot of effort, and it sometimes takes a lot of time to really establish if one is not already there. So recognizing that, what we don't want is, we don't want to lose an opportunity to really have these bundles in play in different community settings. And so HRSA was completely agreeable with that thought. And so they're like, yeah, go for it. Let's see how the bundles can be implemented just in a single organization. So the idea here is that an organization that has their own internal capacity and infrastructure and staff that might have, you know, OB services, family planning services, or it could be a social services agency like a Healthy Start that is working with other community partners to do the clinical piece, but they have wraparound services. They are addressing social determinants of health in their services. They can see themselves in the bundle elements, and they have a way to implement that into an existing kind of QI framework, that they have a way to operationalize those elements in their workflows. And they have a way to collect the data that they can share back with us. So essentially, instead of having, you know, this collective, these various partners sit around the table and identify what pieces of a bundle they could pick up and implement in their own setting, this would be having one organization pick up a bundle and implement it through their own workflows. What's included in both, whether you do it in a collective or whether you do it as a single organization, we really want there to be the clinical community integration. If a single organization is not going to have to convene their partners and do all of the collective piece that a collaborative would do, but we still want them to engage persons with lived experience. We still want them to assess their own capacity to do this work with equity, to be committed to training their staff and their teams on what might be involved in implementing AIM CCI, addressing social determinants, keeping communication about the project in your own organization flowing, and then being able to share back your data. And this is a resource toolkit that is available on our website. So you get a break from me and my voice, and I'm going to turn it over to my esteemed colleague, Ashley Calderon, who is going to talk to us all about safety bundles and our AIM CCI non-hospital bundles. Ashley?
Sure. Thank you, Karen. And I just wanted to address the questions that were in the chat and make sure everybody saw the answers to those in regard to selecting a bundle. Just want to reiterate that we do recommend that you select a bundle based on what you're seeing that's trending in your specific community and based on what those needs are. So we will not assign you a bundle. We want you to make that choice autonomously. And certainly we do not expect you to implement all of the bundles in the 1 year time frame, as Dr. Sully placed in the chat as well. Adding on additional bundles would be at your discretion. So when defining a maternal safety bundle, by definition, we know it's a small set of evidence-based interventions that what we believe when put together improves outcomes. And historically, we've seen safety bundles implemented in hospital settings. We've seen that through AIM, we've seen that through state collaboratives, which some of us in this space are familiar with. So what's unique about AIM CCI is that we are the first group tasked with creating safety bundles specific to community. So all of those pieces that Karen spoke about already, with bringing in community voice, considering lived experience, and really looking at the individual needs of a community, all come into play when looking at birth outcomes. Next slide, please. Karen, looking at time, do you want to play the video series?
No, Ashley, I think we will save that. This was just going to be an opportunity to have you all meet other members of our team and really to have some understanding of how we develop our bundles, but it's available on our website and you'll have this link when you get the recording.
That sounds great.
I'll go to the
Okay. So what we have available on our website right now that's been tested, refined, and published is the Community Care for Postpartum Safety and Wellness. We refer to this in short as the postpartum bundle. So if you're familiar with the AIM ACOG hospital safety bundles, we were tasked with taking 2 of their postpartum bundles, combining those and translating them into community. So those have been through extensive testing with our original 6 pilot sites, as I said, refined, and an abundance of resources placed to help implement those. That is on our website. So if you haven't had a chance to view that yet, you can put your information into the website, and we can link that in just a moment in the chat so that you can look at those in detail. What I would like to point out is that each of the community care bundles has foundational level actions. With the postpartum bundle, you'll see the actions broken down by provider, birthing person empowerment, and then into the foundational level actions. So each of our community care bundle, whether it's interpersonal violence, maternal mental health, or chronic conditions, has these foundational level actions. And the reason we have those is because we, again, want to inculcate equity. We believe that each person who is participating in a safety bundle, whether it's in a collective impact model or in the single entity approach, is defining equity in the same way. So we want to encourage all of our participants to take the Racial Equity Learning Series, to take the SAMRAC for self-assessment measure of racial equity capacity, and think about that data collection process. Again, whether that's within your own organization or that shared data within your collective, but we know that we want this to be data-driven. So when selecting a bundle, we're looking at trends in the community. Once we've selected that bundle, you have several different, anywhere from 13 to 18 actions that you're going to select from. And they're not necessarily in order of how you're going to implement. So you don't have to go down the list and go 1, 2, 3, 4. We want you to look at your own data, get that baseline information, look at what is already being done within your organization or within your community, and pick some of the low-hanging fruit, right? We want to start with those successes, start with what is doable and reasonable and feasible, and then let the data drive you in the direction of your next steps. Next slide, Karen. Oh, okay. Actually, I'm going to say one more thing about the postpartum bundle first. So an overview of the postpartum bundle is we think of it as being a setup for an infrastructure. So the postpartum bundle provides steps to really create a system of care for women and birthing persons. And that's looking at birth throughout that first year of postpartum. We want to provide a structure to support daily processes, organizational culture, and ensure that no matter where a person presents in that postpartum care continuum, that they're receiving equitable care that addresses their individual medical, behavioral health, and psychosocial needs based on their lived experience. So that is available on our website currently. What is coming next is our maternal mental health and wellness bundle. This has been through testing with all of our pilot sites. All 6 of our sites picked this up, implemented it in their community, and provided feedback to us over several months. It is in the final production stages right now and will become available on our website very soon. Thank you. We do have a learning series that will be available that is of no cost to participants that aligns very nicely with the bundle. And I would also point out that Dr. Felita Mass-Jackson, who is a trailblazer in this space for really defining contextualized stress, is our subject matter expert that really led our way with bundle development and was also a part of the learning series that was developed. Next slide, please. So currently under development, we have our IPV or interpersonal violence bundle, as well as the management of chronic conditions. And you can see here which of our original sites are testing those. In Atlanta and New Orleans, they're looking at IPV. And in Fresno, Grand Rapids, Newark, and Tulsa, they're looking at chronic conditions. And that's actually going to be 2 different bundles. There will be one available looking specifically at that prenatal and pregnancy timeframe, and then looking at the postpartum period in a separate bundle. We are in the midst of testing these and gathering resources now, and we anticipate that all 3 of those bundles will be available in the fall. So as a partnering organization, you will have access to choose one of these 3 if you would like, although they will not be publicly available on the website in a finalized production yet. But we will be happy to support the implementation of those 3 bundles with any new partnering organizations that join us. Next slide, Karen. And here's just kind of an overview of resources that you can see some visuals of what we have to support AIM CCI implementation. We have that racial equity learning series. We have a RELS, racial equity learning series, we call RELS, leadership user guide. We have our clinical community integration roadmap, the maternal monologues. We have the several different learning series and more in the works. So just to give you an idea of what we have available to you. And again, these are publicly available with HRSA funding, and there's no cost to the users. And our learning series are accredited by APHA and have CEUs that are affiliated with those. Next slide. Okay, so I'll pause there and see what questions you have about bundles. Let me look in the chat and then I'll turn it over to Dr. Sully. Karen, do you want to address that question?
Yeah, Julie, can you come off mute and tell me again about this question that you have? I may be a little bit confused on how I'm reading it.
Yeah, I'm just wondering, so we are a state that receive the original AIM safety bundle, hospital-based funding directly from ACOG, and now recently we have applied to get funding for HRSA to implement a new safety bundle in the hospital setting. So I'm just wondering if we already have a player in Vermont that does that work in the hospital setting, can that be the same organization that applies for AIM CCI grant, or should it?
So there's nothing to preclude you from applying for AIM CCI if you have AIM. The big difference, I think, is that the applicant, whether they're going to come in as a single organization or if they're going to come in as a lead organization working with the collaborative, has to be able to have work in the community. So it really isn't applicable to statewide, you know, like if you're a big state infrastructure, this model doesn't fit that very well. If you are working, if you have the capacity and the reach within an identified community to do this work, then yes, you can apply. You can be an AIM partner, and you can be an AIM CCI partner at the same
Got
time.
it. All right, thank you so much.
Yep. Katie?
Hi, I was just curious, when you were going over the bundles, I didn't see anything around substance use disorder, and I wondered if that is something that kind of falls under the chronic care or chronic conditions, or maybe the mental health. I just wondered what your intake or your input was on that.
No, that's a great question. And we do not have a bundle that is specifically looking at substance abuse at this time.
All right, thank you. If there are no other questions, we'll turn it over to Dr. Sully.
Hi, Katie, just to add on to your question, I think, so in regards to the QI part and assessment part of the evaluation part, there are elements of substance use in the maternal mental health bundle. It doesn't go as detailed as I will say probably the AIM substance use disorder bundle, but there are some elements within it, and in terms of the evaluation or the tracking measures, for example, we do have some of the elements that specifically asks about that. To quickly go over how we rationalize, at least our rationale for QI, a lot of the structure of our measures or even evaluation part has been based on the Denobedian process. Now, this is not to say that this is the most effective strategy. It's a very old model. And there are new models in healthcare, as we all know, in terms of quality improvement. There is a 7-step, 7 tools that has been very popular recently in healthcare settings. But again, we believe that taking the Denobedian theory as the basis or the baseline of what we do could serve as an easy way of translating some of the things that are currently in place, such as the PDSA cycle and its easy applicability to this process. So in that vein, we see this in terms of assessment, looking at process, structure, and outcome. Now, we do believe that it will take time for us to see clearly the effect of implementation. So it sometimes gets frustrating when you want to see the outcome, you want to see the product of your work. One thing that we always want to tell people is it will take time. So we do have, let's say, long-term, intermediate, and short-term measures. In the short term, a lot of our focus is having that change in behavior, looking at the structural changes, things that are currently in place and how we can be able to modify them to ensure that they can aid in the implementation. And then we go towards the process measures, which is where we put a lot of our focus in the short and intermediate term to things that we know as a result of your activity within your facility, within your community, we can be able to say, because of your changes, because of your review, you have been able to do A, B, and C. So those are some of the dynamics, those are some of the things that we are looking at. And a lot of the process measures, for example, one process measure that I like is in the postpartum bundle is looking at care coordination, for example. And care coordination specifically looking at based on the most up-to-date ACAR guidelines. Now, we know that for mothers or birthing people that meet the SMM criteria needs to be seen within a certain time frame. Now, in a lot of our communities, there is a gap between when they are seen versus when the recommended timeline is. So specifically, this measure asks about being able to see these populations within the certain time frame. And a lot of research now has validated the utilization of such time frame to ensure that what we do is evidence-based. So that is the general overview of how we look at things. We have process, structure, and outcomes. Overall, for each bundle, and I think I will say this for even the future, it's highly unlikely for us to go towards more than 4. I mean, when I say four structure measures, 3 process, and the 3 outcomes. So we do track this in our data systems that has recently been upgraded. As a site, you'll be able to track all the participants. And again, if you're having a collaborative model, you'll be able to track, even if you have different programs within your system, you'll be able to track that in the AIM CCI system. So we do have the several resources to aid in using the tools. But again, the idea of the system is to provide a global perspective of how we measure, or how we can be able to track our progress, and hopefully use that data, use that information that we have in the system to inform our work. So it's fairly straightforward. We only take aggregate data. We do not take any PIs, and all the data is relatively easy to navigate, easy to use in terms of interact with in the AIM CCI data system. Next slide, please. Okay, thank you very much. I'll stop here, and we will be talking about expansion. And if you have any questions, please feel free to put it in the chat, and I'll be more than happy to answer them.
Thanks, Sonny. Any questions for Dr. Sully? Real quickly, we are trying to stay on time, but we are happy to answer questions, and we have our contact information at the end of this. And so please feel free to reach out after this offline. So our application is available online, and it's pretty straightforward. Here you will find it. Brief overview of a lot of information that we talked about today. Some dates, contact information, all of the program background that you've just heard is contained in this PDF version. So this PDF gives you everything about the approach, our definitions, and then what we're looking for in the application, your eligibility to apply either as a local maternal safety work group using a collective impact model, or for single entity organizations. We really want to hear from you, your story. Why are you interested in AIM CCI? What's going on in your community? If you're applying as a collective, who are your partners at the table? How do you work together? How do you address equity in this work? Your capacity, what each person is really bringing to that collective. If you're a single entity organization, tell us about yourself, your staff, your capacity internally, how you collect data. And then we're looking for letters of commitment from all applicants to show your capacity and that you have the reach in the community. And very importantly, if you have a federally funded Healthy Start project in your community area, then we really want you to reach out to Healthy Start for a letter of commitment, either to be a part of your local maternal safety work group, if you are applying as a collaborative, or as a supporting partner to say that they support your application and ability to do this work in community. Amber, I think I'm stuck because, can I go back and close this without losing everything?
You should be able to.
My little controls are looking weird. Hold on. If y'all lose me, Amber will take over, but I'm just gonna do this. Okay. I don't know what y'all are seeing because I'm seeing a big blank screen.
We see application at a glance.
This is so weird. I'm not seeing anything. Huh. Okay. So let me just pivot here because I've lost my screen. I'm glad that y'all can see. I'm just going to stop sharing that. because the next couple slides are really just reiterating what's in that application. We are accepting applications now. It's open. We have a due date of July 15th. All of that information is contained in the application. Thank you, Amber, because I really have no idea what happened with mine. If you can go to the next slide. Yeah. Once we receive applications, make selections, we'll reach out to new partners to give you information on the contract, a work plan, and a budget. We will set all of those up. Anticipated date for this cohort, because of where we are in our current fiscal year, would be August. August right now will start, and they'll be signed by then. They will run for 1 year, so it would be August through July. If you sign with us in September, it'd be September through August. So these are 1-year agreements, because again, we are in our final year of the pilot phase. So I am going to stop there. And again, we will share this recording. You will have information on the application. You should have that. It's on the homepage of our website as well. There's lots of other information on our website if you haven't already explored it. But in the last, well, we're at 12:30 according to my clock, but if anybody has any questions at this time as we wrap up, please come off mute and we're happy to answer.
I have a question. I may have missed this, but is there money associated with this or funding?
There is.
Okay.
So, and it's explained again also in the application for entities coming on, for or rather applicants coming on, applying for the collective impact model to pull together a collaborative to do this work, or to integrate this work into an established collaborative. If you don't already have a collaborative, we really are advising you to take a look at the single entity option because of the time that it can take to pull together a collective impact model. If you come in with an established collaborative and want to set up a local maternal safety work group to implement AIM CCI bundles, then that funding is at $22,000. If you are a single entity organization and you are looking to bring this into your own workflows in your own capacity within your purview of services, that funding is at $10,000.
Got it. Thank you so much.
You're very welcome. Any other questions? Well, again, thank you all for joining us on a Friday before a holiday. We absolutely appreciate your interest and the time that you've given us today to explore AIM CCI. We're very excited about this initiative and this juncture where we are working with new communities and expanding across the nation. And so we look forward to receiving your applications. And in the interim, should you have any questions, please do feel free to reach out to any of us. There's no wrong door. You can reach us at aimcci@nationalhealthystart.org. Thank you all so much. Appreciate your interest, and y'all have a great, safe, and fun holiday weekend.